Hi, it's a continuation of my first video because it cut off. Sorry. So because of the Tarasoff case, a lot of things have came to light, like duty to warn and duty to protect in mental health fields. For example, in mental health, therapists should find out whether a patient has ever ever seriously injured or thought about seriously injuring another person, especially with new patients or other patients whose symptoms are becoming worse. It is important to know whether they are dangerous to others and whether the danger is due to mental illness. So basically, what this is telling us is that as counselors, we have to assess whether a patient is making a serious allegation or if they're just saying something due to just having a mental illness breakdown, I would say. Duty to protect can involve warning the potential victim, notifying the police, starting commitment hearing, informing mental health evaluators of the threat, and utilizing professional supervision. So, if the allegations are true, then we have to set things in motion and like this person had mentioned, we have to notify the police. Basically, everyone has to get involved at that point. We have to warn the victim, the potential victim, and do what's best in protecting that person. As mandated reporters, we must go to the extended length to make sure that that does not happen because we can get in serious trouble. Failure to protect potential victims of violence can result in losing one's job at an agency. Protecting the well-being of homicidal suicidal clients is the obligation of professional social workers. Counselors should frequently utilize supervision and consultation when working on this issue, duty to protect. So, in duty to warn and protect in HIV/AIDS cases, mental health professionals do not have the legal right to disclose that a person is HIV positive to another person. This is at the discretion of physicians in many states. However, social workers and mental health professionals must struggle with this legal situation if a client insists on potentially harming another person through the risks of HIV. So basically, the doctor can't report you having HIV, but disclosing this information to health professionals or social workers puts you at risk, especially if you're still having like active sex, knowing that you have HIV, because you can potentially pass on this disease. In domestic violence, in working with clients who have history of domestic violence, it is important to do a risk assessment of the situation to determine if there is a potential for harm. A social worker is counseling a couple around issues in domestic violence. The husband reports that he has made threatening comments to his wife in the past. The wife has threatened to divorce her husband. The husband has stated that he would hurt his wife if they divorced. So basically, in that case, then you just kind of assess the situation if you should report or not. Is this threat serious? How is she going to assess the situation to possibly carry out your duty to warn? So those kind of things have to be kept in mind. So duty to warn and protect in medical settings. Ethical concerns and the duty to warn and duty to protect. Since the first Tarasoff decision in 1974, there has been an expansion of debate around duty to warn and duty to protect. Is that literature has expanded to include mental health, HIV, and domestic violence and medical issues. We assess whether and when to apply duty to warn or protect when to protect confidentiality, and this is not an easy decision. We must gather relevant data to evaluate dangerousness and make determination based on this data. Once determining a situation to be dangerous, a course of action must be taken. The therapist must implement this decision. So basically, at the end of the day, it's our decision to report if we think that our client is making a serious allegation about a person harming him or him personally harming another person. We assess them basically we assess them based off on what we know about them. And if it's a serious allegation, then we must report to the serious channels. But if it's due to mental illness, then we should still do our job and get that person the help that he needs. The challenges to making a decision about duty to warn and duty to protect are based on whether the client poses a serious risk of violence to another and what steps are necessary to protect an intended victim. So basically, that is what the Tarasoff case is, and that's what the Tarasoff case had helped put into work in our system. Thank you.